These are my blood slides. I did 1 second per slide for my reticulate counts and differentials and all that fun stuff. This is my contrast study. I used my own puppy and barium. These are the pictures from my dental radiographs. This is me starting to position. We realized as I was starting to position this that the x-ray machine was not close enough. Because I couldn't get a good angle on it, so we cut the video here and did another section of it again here. This is us doing the bottom side of the jaw, I believe. Not the part that shows the nice front rostral part. With the incisors. This is showing the back molars. Took us a couple of tries to get the right angle on it, but you know, x-rays, trial and error. Hopefully not too many. As you can see, I am wearing my dosimetry badge. We do walk out of the room every time. We pause it in between. This is me getting those nice canines in. Please ignore that. Going back for those back molars. Actually, this was done before the canines and incisors. I just put them out of order on the video. As you can see, our machine, we highlight the teeth that we want to do and then press record. This is me getting my CPR simulation done. I have a giant stuffed teddy bear that I'm using. I do put it in a trach tube. I believe I tied it fast using some gauze. I'm collecting all my materials. I could have edited this part out. Like I said in a previous video, I'm doing this at like 1 o'clock on New Year's night. I'm putting on a tourniquet. I did forget to take it off at the end. I realized that at the end. I'm only putting the tourniquet on to simulate not having somebody there to help me. In a real emergency where we'd have to do some CPR, it'd be all hands on deck, of course. But because I'm using a nice big bear, it is not. Big stuffed bear. Me taping a catheter on. I left the catheter closed and everything just so that way we could reuse it, because you don't want to waste things. That was me pausing it just so that way somebody could walk in front and place a sticker over there. I am currently standing in our surgery prep area, but we didn't have any surgeries, so. I was using it. Just making sure that the IV catheter is quote unquote placed. Getting that trach tube in. This is all assuming that we've already given anesthesia and all that fun stuff. I'm measuring the tube. Obviously, not actually measuring it. Inserting it, making sure I spread the epiglottis so that I can get between the two tissues and down into the lungs. Sort of. Not all the way into the lungs, but, you know. Tying it fast with some gauze so that it stays in the mouth. Don't want a dog waking up and spitting it out, choking on it. Attaching a, I don't actually remember what it's called, but it's the thing that beeps to let you know the air is flowing. Attaching the air hose. Listening for a heartbeat. 15 seconds. Do have my watch on. Yes, I am going to make you watch all 15 seconds of me counting this. Do the same thing for the breathing. I did end up multiplying by 2. Obviously, the heart rate was there. Well, obviously not, but like for purposes it was. But it was low. This was the breathing rate. Actually, there was no breathing. That's CPR. Attaching the ECG leads. I did not have a machine up and running, obviously, so I was using the old ones that they don't use anymore. Just so that way, heaven forbid, an emergency came in while I was filming this. They had access to things. Because you never know when you're working in full service. Emergencies happen all the time. I really should have planned this a little bit better. They needed the fluids, so I did have to pass those off. Me simulating giving breaths. Actually, I don't think I have the fluids hooked up yet. I don't actually remember if I did or not. Oh, yep, here it is. Me simulating the fluid hookup. At this point, I would take the cap off of the IV that we had put on it, attach the fluid after making sure there was no error in the line, and monitor how much fluid was being given. Obviously, since I did not actually IV this bear, I didn't do any of that. But, and then this is just me using an old vaccine bottle as a fake emergency drug, pulling up fake emergency drugs. I did forget to fake give it them through the IV, but I did have to end up giving a drug via IV. So I did hold off the line before the spot where I injected the medication, and every so often I took a clean saline sterile flush and flushed that through the IV after making sure there was no bubbles. Giving chest compressions, they're not the best. I did take a CPR class in high school. This is not any certificate for that. And that my face looks like that because I felt ridiculous doing it on a stuffed bear. And that was that. That's me showing all the equipment I have set up for it.